Welcome to our detailed exploration of attention deficit hyperactivity disorder, commonly known as ADHD. In this video, we will uncover what ADHD is, its symptoms, causes, and the available treatments. Our goal is to provide a thorough understanding of ADHD, supported by expert insights and scientific research. Stay tuned as we dive into the fascinating world of ADHD. To kick things off, let's set the stage. ADHD is a topic that affects millions of people worldwide, yet it remains widely misunderstood. Whether you're a parent, teacher, healthcare professional, or someone living with ADHD, this video aims to shed light on every aspect of this condition. We'll explore the latest research, hear from experts in the field, and share real-life stories to give you a comprehensive view. So, grab a cup of coffee, sit back, and let's embark on this educational journey together. ADHD is a neurodevelopmental disorder affecting both children and adults. It is characterized by patterns of inattention, hyperactivity, and impulsivity, which are more severe, frequent, or interfering than typically observed in individuals at a comparable level of development. Let's break down what this means and how it impacts daily life. To understand ADHD, we need to delve into the brain's inner workings. Imagine the brain as a complex network of highways where signals are constantly being sent and received. In individuals with ADHD, these signals can be misrouted or delayed, leading to the characteristic symptoms of the disorder. We'll look at how these neural pathways function differently in people with ADHD and discuss the implications for daily activities, from schoolwork to social interactions. We'll also touch on the history of ADHD, tracing its recognition and diagnosis through the years. To understand ADHD, we need to delve into the brain's inner workings. Imagine the brain as a complex network of highways where signals are constantly being sent and received. These signals are like cars traveling along the highways, carrying important messages that control everything from our thoughts and emotions to our movements and behaviors. In a typical brain, these signals flow smoothly and efficiently, ensuring that all parts of the brain communicate effectively. However, in individuals with ADHD, these signals can be misrouted or delayed, leading to the characteristic symptoms of the disorder. It's as if there are traffic jams or detours on these neural highways, causing disruptions in the flow of information. This can result in difficulties with attention, impulse control, and hyperactivity. For example, a person with ADHD might find it challenging to focus on a single task for an extended period, or they might act impulsively without considering the consequences. We'll look at how these neural pathways function differently in people with ADHD and discuss the implications for daily activities, from schoolwork to social interactions. In the classroom, a student with ADHD might struggle to stay seated, follow instructions, or complete assignments on time. This can lead to frustration for both the student and the teacher. At home, these challenges might manifest as difficulty in completing chores, maintaining routines, or managing time effectively. Socially, individuals with ADHD might find it hard to wait their turn in conversations, leading to misunderstandings or conflicts with peers. We'll also touch on the history of ADHD, tracing its recognition and diagnosis through the years. ADHD is not a new condition. It has been described in medical literature for over a century. Early descriptions of what we now know as ADHD date back to the early 1900s, when it was referred to as hyperkinetic impulse disorder. Over the years, our understanding of ADHD has evolved significantly. Advances in neuroscience and psychology have led to more accurate diagnostic criteria and a better understanding of the underlying mechanisms of the disorder. Today, ADHD is recognized as a legitimate and treatable condition, with a range of interventions available to help individuals manage their symptoms and lead fulfilling lives. The symptoms of ADHD are divided into two categories: inattentiveness and hyperactivity. Impulsivity. Inattentiveness may include frequent carelessness, distractibility, and forgetfulness. Hyperactivity and impulsivity might manifest as excessive talking, fidgeting, or an inability to wait one's turn. Recognizing these symptoms is the first step towards understanding ADHD. Let's dive deeper into these symptoms. Inattentiveness can often be mistaken for laziness or lack of interest, but it's much more complex. We'll explore how this manifests in different settings, such as at home, in school, or at work. Hyperactivity and impulsivity, on the other hand, can be more visible but equally misunderstood. We'll discuss how these symptoms can affect relationships and self-esteem. Additionally, we'll hear from individuals with ADHD about their personal experiences, providing a human perspective on these clinical terms. While the exact cause of ADHD is not known, it is believed to involve genetic factors, brain structure and function, and environmental influences. Research shows that ADHD tends to run in families, suggesting a genetic component to the disorder. Join us as we explore the intriguing factors behind ADHD. The causes of ADHD are multifaceted and still under investigation. We'll delve into the genetic links, examining studies that show how ADHD can be inherited. Brain imaging studies have revealed differences in the size and activity of certain brain regions in people with ADHD. We'll also discuss environmental factors, such as prenatal exposure to toxins, early childhood experiences, and even diet. By understanding these causes, we can better appreciate the complexity of ADHD and the importance of a holistic approach to treatment. Treatment for ADHD can include medications, psychotherapy, education or training, or a combination of treatments. Medications can help manage symptoms, while psychotherapy can address behaviors, and educational interventions can assist with academic challenges. Discover the various paths to managing ADHD effectively. Treatment for ADHD is not one-size-fits-all. We'll explore the different types of medications available, including stimulants and non-stimulants, and how they work to balance brain chemistry. Psychotherapy, particularly cognitive behavioral therapy, CBT, can be incredibly effective in helping individuals develop coping strategies. We'll also look at the role of lifestyle changes, such as diet, exercise, and sleep, in managing symptoms. Educational interventions can make a significant difference for children with ADHD, and we'll discuss strategies that teachers and parents can use to support learning and development. Treatment for ADHD is not one-size-fits-all. Each individual with ADHD may respond differently to various treatments, so it's crucial to tailor the approach to meet their specific needs. We'll explore the different types of medications available, including stimulants and non-stimulants, and how they work to balance brain chemistry. Stimulant medications, such as methylphenidate, Ritalin, and amphetamines, Adderall, are often the first line of treatment for ADHD. These medications work by increasing the levels of certain neurotransmitters in the brain, such as dopamine and norepinephrine, which help improve attention and focus while reducing hyperactive and impulsive behaviors. Non-stimulant medications like atomoxetine, Strattera, and guanfacine, Intuniv, offer an alternative for those who do not respond well to stimulants or experience significant side effects. These medications also target neurotransmitter systems, but in different ways, providing a broader range of options for managing symptoms. Psychotherapy, particularly cognitive behavioral therapy, CBT, can be incredibly effective in helping individuals develop coping strategies. CBT focuses on changing negative thought patterns and behaviors, teaching skills such as time management, organization, and problem-solving. Through CBT, individuals with ADHD can learn to manage their symptoms more effectively, improve their self-esteem, and enhance their overall functioning in daily life. Therapy can also address co-occurring issues such as anxiety or depression, which are common in individuals with ADHD. We'll also look at the role of lifestyle changes, such as diet, exercise, and sleep, in managing symptoms. A balanced diet rich in nutrients can support brain health and improve concentration and mood. Regular physical activity has been shown to reduce symptoms of ADHD by increasing the levels of neurotransmitters that regulate attention and behavior. Adequate sleep is essential, as sleep deprivation can exacerbate ADHD symptoms. Establishing a consistent sleep routine can help improve focus and reduce impulsivity. Educational interventions can make a significant difference for children with ADHD, and we'll discuss strategies that teachers and parents can use to support learning and development. In the classroom, accommodations such as extended time on tests, preferential seating, and the use of organizational tools can help students with ADHD succeed. Teachers can implement behavior management techniques, such as positive reinforcement and structured routines, to create a supportive learning environment. Parents can work closely with educators to ensure that their child's needs are met and to reinforce strategies at home. ADHD is a complex disorder, but with the right approach, individuals can manage their symptoms effectively. It's important to consult healthcare providers to tailor a treatment plan that suits individual needs. Thank you for joining us on this journey to better understand ADHD. As we wrap up, let's recap the key points we've covered. ADHD is a multifaceted disorder that requires a comprehensive approach to treatment and support. By understanding its symptoms, causes, and treatment options, we can better support those affected by ADHD. Remember, seeking professional help is crucial, and there are many resources available for those who need them. Thank you for watching, and don't forget to like, comment, and subscribe for more informative content. Together, we can spread awareness and understanding of ADHD.